I'm Dr. Tara Suntum, and I'm a pediatric hematologist and oncologist at MedStar Georgetown University Hospital. The patients I see range from newborns all the way up to young adults in their 30s, and we treat patients who have blood disorders, meaning they have problems with their red cells, their white cells, or their platelets, and we also take care of patients that are affected by cancer, and that can range from leukemias and lymphomas to sarcomas and other solid tumors. And I also take care of patients after they have finished their cancer treatment in our survivorship program. My philosophy for treating my patients is really to treat them how myself or my family members would want to be treated. And to me, that means really having open communication with them and forming a partnership in their care. So for me, I really take the time during each visit to listen to the patient's concerns and understand what the issues are and try my best to answer all of their questions. And if there's something I can't answer, I make sure to get them to someone who can. And then as far as being a partner in their care, I really think of us as a team, and we discuss everything, including diagnostic workup that's going to happen and the treatment options that they may have, and we come to a decision as a team. And then I also try to advocate for them outside of our department when they need to see other subspecialists or have other studies done. I really try to work with them to make sure all of those things can happen and take a little bit of the burden off of them. Pediatric hematology oncology is always an exciting field because there is a lot of research going into the cancer treatments and supportive care for these patients. And the pediatric hematology oncology global field is really collaborative, and there are a lot of clinical trials going on and a lot of clinical trial participation by the patients. So we're able to gain knowledge of different research questions that we have and make advances in the field at a relatively quick pace compared to some other medical fields. We have a wonderful team here at MedStar Georgetown, especially our pediatric hematology and oncology department, where we also take care of adolescent and young adult patients. And it's really every level of provider in our department that really focuses on patient and family-centered care. We are a very close-knit division, and we make sure that we take a comprehensive approach to each patient, and we do multidisciplinary meetings where we assess each patient and their needs and make sure that they're connected with the support services they need. And then we also have the resources of the Comprehensive Cancer Center and the services that the adult oncology team has access to, including a lot of clinical trials, both on the adult side as well as the pediatric side. I feel truly fortunate to be able to take care of these patients. I think we become like a primary care provider for them, and we see them so frequently. We get to know their life stories and become like close family to them, and I really think that's a big privilege, and I really truly love getting to know the patients and their families and to help walk the journey of their treatment with them and get them to the other side. The definition of a cancer survivor is one that can be interpreted in many different ways, but the standard definition is actually once a patient is diagnosed with cancer, they become a cancer survivor. And as they are living with the diagnosis and going through treatment, they are a cancer survivor, and then they move into a different phase after their treatment is finished, and they're a cancer survivor for the rest of their lives. And for some patients, that is a tricky concept to come to terms with, and they don't feel like they're a cancer survivor until they've completed their treatment. And I think that's okay, that every patient comes to their own meaning of what that means to them, and that's what we help them get to as their providers as well. The transition to survivorship care does depend on what type of cancer that patients were diagnosed with and any complications that they are facing during and after their treatment. But generally, patients will transition around 2 to 5 years after therapy to a survivorship clinic. Our survivorship program here at MedStar Georgetown focuses on the whole patient. And by that I mean we focus on their physical, psychological, and social needs. For every patient that comes through our clinic, we create a personalized treatment care plan for them. And that includes details of all their treatment that they had for their cancer, including any surgeries, any radiation, and any chemotherapy. And based on the treatment they received, we tailor the recommendations for follow-up with particular studies, including lab tests or imaging studies, or other specialists that may need to be involved in their care. We also have a multidisciplinary care team for our survivor patients, which includes a psychologist, social worker, and other supportive care services, including integrative medicine specialist. And we're able to tailor those specialties for each patient depending on what their needs are. We've had several patients that have benefited from our integrative medicine specialists with their neuropathy or their nerve pain that they develop from cancer treatment. And we also have a nutritionist who's also been very valuable for our survivor patients. At each survivorship visit, we actually contact their primary care doctor and any other specialists that are actively still involved in their care, and to make sure that they have the treatment summary that we've generated for the patient and understand what the recommendations are for any surveillance that they may need for late effects. And we also recommend that patients themselves carry the treatment summary with them to other appointments that they may have, or even keep it on their phone, just something accessible so that when they're seeing other doctors, they're aware of their cancer history and what treatment they had and what potential late effects they may have from their treatment. And this is really to provide them with the best care as they're getting evaluated for other things that may come up in the future. Cancer treatment can cause infertility for patients, and it really will depend on what type of cancer treatment that the patient received. Radiation is one of the treatments that can cause infertility if it was near or to the reproductive organs. If patients had surgeries involving their reproductive organs, that will also be a factor in potential fertility. And then chemotherapy, there are some chemotherapy drugs that do increase the risk for infertility. So these are all things we take into account when we're doing what we call a fertility risk assessment for patients. And we do this before they start treatment and then also after they've completed treatment. And before treatment, we always have a discussion with the patients and their families about the potential risk for infertility, and we work with them to identify resources within the community if they desire options to try to ensure that they have the ability to have a family in the future. After the treatment's complete, we do a fertility risk assessment again, where we look at all the treatment that they have received and we risk stratify them of their potential risk of infertility. And it's always important that we make sure that they know that this is not absolute. But we work with them to decide when and if they want to undergo some fertility testing to see if they are able to start a family, and we provide them with resources in the community to help them do so. Once children finish their cancer treatment or young adults finish their cancer treatment, there certainly can be some effects on their functioning in the school or work environment, and this can be from a lot of different factors. Some of the chemotherapy that they receive will potentially cause what we call some neuropsychological side effects, and this can vary a lot depending on the patient. Sometimes it can be with their ability to concentrate in school or at work. Sometimes it can be with problem solving. Sometimes it can be with memory. And so we make sure to talk with patients and parents about all the concerns, and with the school about things that they're seeing. And we advise patients and their families to undergo neuropsychological testing. It can be really helpful for patients to have this, and this is where they go through a lot of specialized testing and look at how they function in different environments. And by doing so, they're able to understand where their strengths are and where their limitations are. And with this information, they're able to have the best way to approach school and work so that they function to the best of their ability. And then the other thing is that we also make sure that they have appropriate psychosocial support, because a lot of factors with going back to school or to work is the anxiety and the stress that they feel. So by having good support, that can also ensure good integration back into those environments. There are a lot of things that cancer survivors can do to stay healthy, and they are particularly motivated to stay healthy after having been through cancer treatment. One of the biggest things that we tell not only cancer survivors, but the general public is eating a good, healthy diet is a very good way to stay healthy, and this includes lots of fruits and vegetables, and also maintaining a healthy weight. And there also has been research that shows that moderate exercise for about 150 minutes or 2.5 hours a week is also very beneficial for the health, and this reduces not only things like diabetes and hypertension and heart disease, but it also reduces stress and anxiety. So these are all very important things for patients to try to fit into their lifestyle once they finish their treatment. And then in addition to those things, there are the things that we also counsel everyone about is if they are smoking, they need to stop smoking, and we can work with them to help them do so if they're having trouble. Limiting alcohol intake is also another thing that they can do for their health. And then staying on top of all their regularly scheduled visits with their primary care doctor, going for regular dental exams, seeing the eye doctor regularly, keeping up with their vaccinations that are recommended. Those are all really important for their health, and by making sure that they're keeping up with all those things, we can catch anything as soon as symptoms or other issues arrive, and we can intervene early. Adolescent young adult oncology, or what we say AYA oncology, means patients who are between the ages of 15 and 39 years old. And this is a group of patients that was identified as being kind of lost between the pediatric and the adult worlds and losing out on things like access to clinical trials and other resources. And now programs across the country are developing AYA programs to specifically focus on the needs of these patients, and MedStar Georgetown is one of them. We really aim to have a place where these patients can have access to both pediatric and adult oncologists so that we can help decide the best treatment for them. Sometimes that may be that they're treated on a pediatric treatment protocol because we know that for certain types of cancer that young adults do better on pediatric protocols. And sometimes it might mean that they're treated on adult protocols, but it's important for us that we work together and we come up with the best treatment regimen for the patient depending on their cancer type that they have. And it also means access to a lot of psychosocial services because the patients that are in this AYA range have a lot of unique psychosocial needs. And so we have our multidisciplinary team, including social workers and psychologists and psychiatrists that can help assess their needs and support them through their treatment. Our AYA program here at MedStar Georgetown includes oncologists within the pediatric hematology department, and then we also collaborate with the adult oncologists in Lombardy. So we evaluate patients and then we discuss them at multidisciplinary conferences where we can elicit opinions from other providers, whether that be the adult oncologists or the surgeons or the radiation therapists. We have a really collaborative department where we look to find the best treatment options for patients. And we also have services including psychology that are dedicated specifically to our AYA population. And if patients desire to go elsewhere, they help to plug patients into the community to the services that they need. We also have an integrative medicine specialist for these patients and has been very helpful in helping manage symptoms that arise from cancer treatment. We also have a nutritionist who is able to consult on all of our patients and provide them with recommendations to stay healthy and to help with symptoms they may be having from their treatment. We also have wonderful social workers who work with each and every one of our patients and really get to know them, and our patients trust them and are able to confide in them problems that they may be having, and our social workers have access to a lot of different resources to be able to help our patients. The multidisciplinary care team at MedStar Georgetown involves a lot of different providers, and for discussing the treatment that's best for the patient, that includes oncologists from both the pediatric and the adult side, as well as the surgical specialties, and that is different for each patient. For patients that have bone tumors, for example, that'll involve the orthopedic doctor, and for patients that have brain tumors, that'll involve the neurosurgeon. The other provider that's present is the radiation oncologist to help provide insight into whether radiation would be a beneficial treatment depending on the patient's cancer type. And we have detailed discussions for each patient to take into account what type of cancer they have, where their cancer is located, and what the patient's goals are for their treatment. And so we all discuss those factors into the decision and help come up with the best treatment plan for patients. And we also have our multidisciplinary care team that focuses on the patient each step of the way going through the treatment. And that involves a lot of different people, and that involves our social workers, our psychologists, our art therapists, our nurses, our nursing coordinator, our child life specialists, and our integrative medicine specialists. And we're fortunate to all work really closely together, and we meet on a regular basis to make sure that we are aware of all of our patients' needs and are addressing all of them. And we can do so from a lot of different angles depending on what is arising for each patient. And I think the opportunity to have integrative medicine consultation is really unique to our program and has been very helpful for a lot of our patients to help support them with symptoms they may be having from their treatment. When an AYA patient is diagnosed with cancer, I think it is really important for them to find the right place to be treated. And by that, I think it's important to go to a place that has experience treating these patients. Being at a place that has both pediatric and adult oncologists brings together the knowledge of the treatment options going on in both worlds, and also allows us to figure out what would be best for that patient. Being at a place that also has access to clinical trials is important because that helps advance the field of oncology, as well as give them the options of the latest therapy that's going on for their cancer. I think it's also important to be at a location where they have access to a lot of different resources, including psychology, integrative medicine, nutrition, physical therapy, occupational therapy, and those are all things that we can provide within our AYA program at MedStar Georgetown.